Powerful currents are reshaping our world. Climate change, aging populations, inequalities, conflict, and technological advances are transforming the way we live and the health of our societies. While these megatrends bring challenges, they also open doors for innovation and bold, impactful change. To navigate these currents, the second European programme of work will be our Health Compass, guiding us toward a healthier, fairer, and more secure future for all. Your voice, our future.
Good morning, good afternoon, and a warm welcome to the launch of our series of hearings to shape the second European programme of work, which we like to call in short EPW2. We are truly excited to have you with us and engage with you over the next 2 months and with member states, non-actors, academic partners and many others to shape the future of health and well-being in Europe. Today's hearing is composed of 2 parts. We start with a 30-minute high-level launch to set the stage for the series of 5 hearings. This will then be immediately followed by our first hearing on non-communicable diseases and mental health. For the launch segment, we are honored to have an exceptional panel with us. Please join me in welcoming Dr. Hans Kluge, our WHO Regional Director for Europe, sharing his vision for EPW2. With us virtually, Katrín Jakobsdóttir, former Prime Minister of Iceland, a champion of health equity and sustainable development. Dr. Alexei Tsoi, former Minister of Health of Kazakhstan, advisor to the President, bringing to us insights from a country that has been a leader in primary healthcare transformation. And Judita Pörndretsai, our youth representative from Albania, ensuring the voices of the next generation are front and center.
I think a good place to start our conversation today is to pick up this concept of megatrends that we saw in the video as well. This will set the stage for the 5 hearings very nicely. These are not just distant future possibilities, these are already realities that are shaping health and well-being in Europe today, like climate change, demographic shifts, technological change, and others. And I would like to bring in at this point our WHO Europe Regional Director, Dr. Hans Kluge. Dear Hans, I would like you to take the conversation forward. Why is EPW2 so profoundly important at this particular point in time? And why was the decision taken to shape it through the lens of megatrends?
Yes, morning Melita, Gondo, Prime Minister, Minister Tsoi. Such a pleasure that we are kicking off. So EPW2, let's say, builds on EPW1. It's what I would call the compass for our 53 countries on health and well-being. Because, as we saw in the video, I mean, it's a perma-crisis. So many issues. You can get lost. So you go to the document, what are the big issues? Important not only for the governments, but also for the people. But it's also on the how. What WHO concretely can do. Now, mega trends, remember, from the very beginning, we wanted to be innovative, a little bit different. We're going to do a very, very consultative process. Countries have to be driving the EPW, but also the partners, so they own it. And we thought a good way to do is megatrends, not just around health issues. For example, security. Who in society can tell security does not touch them? The same for demography. And we all have elderly people. We want our parents, our grandparents to live longer, but also in strong health. So megatrends goes beyond the Sustainable Development Goals, beyond 2030, looking maybe to 2050. So it's a whole different way of looking to health.
Very good.
Thank you, Regional Director, also for focusing us on the issues that really matter to people.
Exactly.
And Katrín Jakobsdóttir, your government has had a strong people focus, and Iceland is often seen as a global leader in health equity and sustainability. In your view, How important is it to prioritize these principles in the second program of work for Europe?
Well, thank you, and thank you for your kind words. I think part of Iceland's success in this is that we have the foundation of our healthcare is public healthcare. We secure equal access and try to prevent disparities in access, and of course that's the core. But I think if we dive a little bit deeper, we need to think about health in every policy we make. And I can mention a few examples. For example, a recent development here in Iceland is that we introduced free school meals. And those are important both for equality, to ensure that all children get something to eat at their schools, but they are also important for public health, because of course they are supposed to fulfill health standards. So this is one action that actually can both improve public health and equality. Another thing that I would like to mention is that health must be part of everything, all our planning, city planning, transport planning, both because climate and health and environment and health are so closely related. We want to reduce air pollution, we want to reduce carbon emissions. Doing that can actually have very positive health benefits. But I think also when policymakers are taking or making their decisions, they need to think about how can we ensure that people can enjoy nature, can actually do sports. I could mention one example from Iceland, which are our public swimming pools, where actually everybody goes, both to have a healthy movement, but also to talk to other people, which is also important. So I think we need to implement health in every policy we make as policymakers.
I think your intervention underlined very nicely how interconnected all these issues are. And this is why it's so important we focus on these megatrends now, because interconnected issues are very complex to solve. So we don't want to wake up tomorrow in a future that's actually unlivable. And I'm particularly glad that you underline the issue of equity and solidarity. This will be a red thread throughout our EPW2 process, and all the hearings, whatever we're talking about, we will be focusing on who are the vulnerables and how we can address and improve their situation. But let's take this to the realities of our budgets and resources. And Dr. Tsoi, I would like to bring you in here. Many countries are facing intense fiscal pressures, and at the same time, demand for healthcare services are growing, population expectations are growing, they want better services, they want it faster. What can we learn from the experience of Kazakhstan that has actually managed to improve outcomes in a very impressive way while containing the budget?
Hello, thank you very much for the invitation. I think we all know that the PHC is the basis of universal health coverage, and we should allocate the budgets on the PHC level in the countries in order to have the right prevention and prophylaxis. It's very important things how we could reduce our expenditure on health and how we could be effective. And I think that in the governments or in the countries where the big amount of governmental hospitals and medical organizations, those organizations should be as much effective as a private sector. So we need to put attention on to commercialize healthcare in this segment and to run the new IT startups, collaborations with the companies, and work on the educational part, to run the new products, and also to use effective management and marketing for these organizations. We have good experience of centralization of the pharmaceutical departments, and to make delivery of the drugs in person to the wards. So we could save money, about 30% of the expenditure on the drugs. And of course, expenditure we should on a drug is very high in every country, and we need to perform the right purchasing process. And also, for us, we think that's very important to introduce AI, especially to avoid the mistakes of doctors and avoid the extra expenditure, in a social medical insurance funds. And the last point is we have to run the lean technology in the medical organization, to use Kaizen, just to find the right solution and be effective at the medical organizational level. Thank you.
Thank you, Dr. Tsoi. You're making a really important point here, also about controlling the costs, which ensure financial sustainability for our next generation. And talking about next generation, I'd like to turn to Judita. As a youth representative, you've been actively engaged in health advocacy and you participated in our youth consultations. What are the key priorities for ensuring that EPW2 addresses the needs of younger generations, especially if you think of the more distant future? What are your peers saying?
Hello, everyone. I'm glad to be here with you in this video conference. As a youth representative, I was honored to be part of a discussion that not only gave voice to our concerns but also offered us the responsibility to actively shape the future of health. In December, a group of young people, part of Youth for Health Network, came together to explore and identify the key challenges we face in our daily lives. Which will also define the trajectory of the European Programme of Work too. For the years to come, we raise concerns that reflect the urgency of addressing the pressing health issues of our generation. One of the most critical topics we discussed was mental health, which has become a growing concern among young people. Rising levels of anxiety and depression highlight the need for more accessible, destigmatized mental health services. We believe policies should integrate mental health into mainstream healthcare, ensuring that young people from all communities, especially marginalized ones, have the support they need. Another major issue is physical inactivity and obesity, which have reached alarming rates among youth. Lack of access to exercise opportunities and nutritious food in schools and communities is affecting our health. To combat this, we advocate for a European Programme of Work to prioritize policies that promote physical activity and healthy eating, aiming to build a culture of health and prevention that could help mitigate chronic diseases in the future. Substance abuse also emerged as a critical topic. Many young people turn to alcohol, tobacco, and drugs to cope with pressure of life. It is essential that we take immediate action to create a supportive environment with education, awareness, and accessible rehabilitation services. Substance abuse should not be seen as a personal issue, but as a public health concern that requires collective action. In addition, we discussed the significant impact of commercial advertising on youth behavior. Tobacco, alcohol, and fast food industries often target young people with appealing advertisements that hide the long-term health risks. We believe that policies should limit exposure to these harmful ads and focus on educating young people about the long-term consequences of such products. Inequality in healthcare access is another major issue. For many young people, especially from marginalized backgrounds, healthcare remains out of reach due to economic, geographic, and informational barriers. We call for policies that ensure healthcare services, including mental health, are available to all young people, especially in rural and underserved areas, without any financial barriers. Discrimination and stigmatization also affect young people with health conditions, making it difficult for them to seek help and exacerbating their their struggles. We need to challenge harmful stereotypes, raise awareness, and ensure that healthcare is inclusive and free from stigma. Lastly, the effects of climate change on health cannot be ignored. Rising temperatures, air pollution, and the spread of disease are disproportionately affecting young people. We need urgent policies to reduce pollution, promote renewable energy, and improve infrastructures that protect public health. We also believe young people must be actively involved in shaping these policies to safeguard a healthy future for ourselves and generations to come. These are not just issues that need to be discussed, they are the realities of our lives. By addressing these challenges within the framework of European Programme of Work 2, we can ensure that health becomes a fundamental right for all, securing a better, healthy future for both current and future generations. As young people, we are ready to be part of the solution and make a lasting impact on the health landscape. Thank you.
Thank you, Judith, and thank you for being here with us today and for sharing some of the issues that young people are focused on today. And actually, they resonate quite well with the themes of the hearings. You've talked about mental health, the prevention of non-communicable diseases, and importance of healthy lifestyles, issues for the first hearing today. You also mentioned the issue of climate change and many of the other issues that are on the minds of young people, including, of course, our security situation, the technological leaps, and all of them we'll be addressing in this series of our hearings. And we certainly hope that you and many other young people are a very active part of our discussion. But let me maybe step back for 1 second from the themes of those hearings and look at some of the cross-cutting issues that are really relevant for all of those. And one of them being building political commitment for health. And I'm here looking to our regional director here, Hans. You've been emphasizing a lot health as a security issue, also health as a social stabilizer. And I wonder how we can communicate the importance and also the urgency of health to the politicians and also to the public in order to build this political commitment.
Yes, I must say first and foremost, I'm learning on the daily basis, like what former Prime Minister Jakobsdóttir, former Minister Dr. Tsoi were telling. I think shows a lot how we have to think on our narrative. Now you are German, Gundo, so I have to think about the German philosopher Arthur Schopenhauer, who told, health may not be everything, but without health, everything is nothing. And we have seen this in the COVID-19 pandemic. Now to communicate, you mentioned security. It's very clear that the security is very high on the agenda and that we learned that no one is safe until everyone is safe. Whether we speak about the next pandemic, very clear, we also have to share the knowledge on the vaccines, for example. No country is an island on its own. And now I'm thinking a lot about this, obviously, after the decision by the United States with the intent to withdraw from WHO. So to make the argument, security is one. The other one, obviously, is, for example, on competitiveness, right? Whether in Europe or somewhere else, politicians think a lot, are we competitive compared to other regions? Now, if you look at the demography, one of the mega trends we're also going to have a hearing about, if you don't have a healthy population, healthy working population, how can you even think to have a strong economy? So we have to take a step back, be modest, and formulate the narrative that health is and can be part of the solution.
Thank you. Thank you, Hans. And let me ping the same question to you, Katrín Jakobsdóttir. As a former Prime Minister, you presided over many difficult budget dilemmas. And what is your advice on successful strategies to building political commitment to health and well-being?
Well, thank you for that question. During my time in government, that lasted for almost 7 years, we built a strategy, a holistic strategy on well-being in Iceland. And that meant the holistic approach also to the budget, because often we are spending money on consequences and not on preemptive measures. one thing that I learned during this process was actually that the public is really interested in health. We did a public consultation asking people what is most important for you personally, but also what is most important for you that the government, what agenda the government should push. And health was on top of both lists when people were asked. So obviously, health should be a priority for policymakers. Sometimes, as I said, preemptive measures can actually save money later in the day. And then I'm thinking about all sorts of public health measures, how we can implement health in all our policies. I would like to mention maybe two examples. In Iceland, we have been working on shortening the working week to ensure work and the balance between work and personal life. It remains to be seen the health benefits of this action, but many researchers show that actually we can, by doing this, we are actually improving people's health, not just physical health, but also mental health. Another action, when we're talking about budget, we of course can use the tax system to implement changes. And I would like to mention, because Judita was, for example, talking about obesity and the fact that maybe food that contains a lot of sugar is more accessible than healthy food. And there, governments can actually make a difference by using the tax system, make healthy food more affordable and unhealthy foods less affordable. So there are many ways to implement health policies into the budget. But it requires this holistic view that when we are doing something, it actually can make a difference elsewhere in the system. And I think my final point is that we should always be very mindful of the deep connection between health and environment, that what we do on the environmental issues usually has effects for health.
This was a very important conversation about building political commitment. I would like to now switch to another very important cross-cutting issue that really affects everything we do in public policy and in particular in public health. And this is the role of information and communication. I observe younger generations with great admiration. They are so at ease, getting information they need, producing information, communicating it, putting it out there. But I also see their hesitation. What sources can be trusted and how to navigate these information highways. And it's not necessary to mention that our public health community sees a lot of poor quality information, misinformation, and maybe even possibly purposeful disinformation. So how do we overcome this? Judita, let's start with the youth perspective. What strategies do you think would resonate most with your generation to build trust, engagement, and action?
My response to this question is that today's youth find themselves in a unique situation. They have the ability to access the information they want quickly and easily, but they are also faced with an information environment that is often uncertain, manipulated, or inaccurate. This phenomenon is one of the biggest challenges we face today, and it has a direct impact on how young people make decisions about their lives, health, and society as a whole. To help young people navigate this space filled with both opportunities and risks is crucial to develop clear strategies that promote trust, engagement, and action. First, critical thinking and media literacy are key. Young people need to be educated not just to consume information, but to analyze and evaluate it. They should have the ability to distinguish between credible information and misinformation and use that knowledge to positively to influence society. This requires sustained effort from institutions, organizations, and the youth themselves to develop skills that help them become responsible consumers and creators of accurate information. Another important strategy is active participation in content creation. Young people shouldn't just read and watch news. They should also contribute by sharing fact-based, reliable information and promoting ideas that educate and assist others. They can use platforms to share positive messages related to health, well-being, and personal and societal development. Additionally, creating trustworthy spaces for information is essential. Young people should have access to verified and reliable sources where they can find accurate, fact-based information. This could include platforms that allow for the distribution of content that is verified and free from political influences or other biases. Lastly, it is crucial that youth understand their responsibility when sharing information. Every piece of information they share has the potential for significant impact, especially in areas related to public health and social decision-making. They need to be aware that every message they create and distribute can shape perceptions and influence decisions. So it's important they do so responsibly. To help young people navigate this information-rich world, we must invest in educating them on critical thinking, encourage them to create accurate and trustworthy content, and ensure they have access to verified, fact-based information. These strategies will contribute to creating...
Thank you so much for your response. Thank you so much. That was really very powerful, and it gives us a lot of food for thought to build on. Let's take this now to the policymaker perspective. Dr. Tsoi, how can we strengthen the role of science and communication in response to the issues of information and misinformation?
Yes, I think we all know about our new strategy and how we could persuade the young generation to work and to think in this way. The previous speaker described a lot about it, and I just want to add that we have to use the mechanism of behavioral insights, not just pushing towards healthy lifestyle and best practice, and use very friendly social media and to provide the right content for the young generation. And also we're using a very good mechanism in Kazakhstan. It's the kind of group of people who are working on a project like Stop Fake. So they describe about all the fakes in the networks in different areas. So I think the reliable sources are very important, and we should work on it and to run our communicational strategy.
Thank you, Dr. Tsoi, and others for sharing. Wow, time is flying for our little discussion, but before we come to an end, I just want to raise very briefly, and maybe for a concluding perspective, the important issue of innovation. And AI has already been mentioned. And my question is, how can we create systems that allow us to leverage the amazing potential of the innovations in the healthcare sector that are coming our way? And how do we build learning into all levels of our health system? And maybe for this and a concluding perspective, I can turn back to Katrín Jakobsdóttir first, and then we'll finish here in the studio.
Well, 2 points. We need leadership that ensures that lifelong learning is part of the health system, so all the people working there have actually access to getting to know all these new technologies that are developing at an exponential rates and can actually make a lot of difference and have a lot of benefits for the general public. And then I think health, and this is actually something that we have done here in Iceland, health and well-being are part of the curriculum from early education up to secondary schools. And I think health and well-being should actually be part of the curriculum for every child, because this is something that all of us need to be very much aware of, how we can affect our health in a positive way and what we can do ourselves.
Thank you. Katrín Jakobsdóttir and Dr. Tsoi, maybe I can also ask for your view on how to leverage innovation.
Thank you. I think we just put attention on the new direction, like generative artificial intelligence, personal medicine with using AI, virtual assistants, chatbots, digital twins, virtual hospital and telemedicine 2.0, and of course with using IoT and its legislation, using virtual reality, 3D printing. So all this area, I think for us very important, and in our new strategy, we should put attention on it. Thank you.
I would now like to thank our wonderful panel to get us started for the 5 EPW hearings. Yes. Thank you, Hans. Thank you, Katrín, dear Dr. Zöld and Judita. I think this has been really exciting conversation, and you have reinforced our collective concerns. But I liked very much in our conversation that you also have provided some encouraging ways forward. Now it is time to move to our first thematic hearing on how to tackle NCDs and advance mental health in our increasingly complex world. After a short video, I invite my colleagues, Alison Egberg, Technical Officer on NCDs, and Lydia Lazari, Regional Advisor on Mental Health, to take over the baton from Gundo and me here in the studio. Beyond today, of course, we invite you to join all the 5 thematic hearings where your voices will really matter and they will help us shape the future of health in Europe.